am Dhanashree and welcome back to my YouTube channel. I'm so happy to bring to you today Ms. Sakina Husain, who has just secured her national training number in ST3 general surgery applications this year, and she is soon to start her general surgery training in the UK. Sakina, we know each other since our MS General Surgery residency, which we did from KEM Hospital, Mumbai, after which she moved to the UK in June 2023 as a trust grade registrar in Yorkshire Deanery. Then she managed to get her portfolio together within a span of less than 6 months and applied for ST3 general surgery and got an NTN and is now going to start her training. So, congratulations, Sakina. I'm so proud of you. And thank you so much for coming to my channel and sharing your experience, giving valuable piece of advice to our viewers. Thank you, Sakina.
Thank you very much, Dhanashree, for having me. And it's really nice to connect to you. Though we are yet to connect in person since we are in the UK, but at least nice to see you now.
Nice to see you too, Sakina. All right. So, how do you want to do this? First, do you have like a presentation for us?
Yeah, so we can basically run through the short listing process. So now, if you see Dhanashree's YouTube channel, she has already made a very detailed video on ST3 general surgery portfolio, how to build your portfolio. And she's covered the steps of the entire selection process, starting with the Oriel, how to make an Oriel account. That is the actual account you need to make when you apply for the training. Then she's covered very well about the shortlisting process, and then she's spoken about the interview as well. So basically, what I'm gonna do is just share the shortlisting process applied this year. This year was a different shortlisting process, similar to what it was covered over the years, but with major changes. And I would say the changes were very advantageous to people like us who have already had a training outside of the UK, who have been experienced, and this year it was more relaxed for them. So I will just bring up my slides for you and we will talk through it.
Thank you, Sakina.
So basically, the shortlisting is like a self-assessment score. You are supposed to use this guidance given here, score yourself, and submit your evidence for claiming that score. To start with, this is a question number one, in which it says how many months you have spent in general surgery to the July 2024. That was this year. For people who are applying in November this year, for them it will be July 2025. So post foundation, how many years how many years slash months you have spent in general surgery? So as you can see, the more the number of months is that, the less experience, less points you get. Now, this is a major event this year, because as you see, the more experience just fetches you less points, but there is no denominator factor. So
Yeah.
previously there used to be n factor, which was not your score, but your dividing factor for your total score. So this year they just give you less marks for the point for your more experience in general surgery, but it doesn't act as a n factor. So it's a very major event.
Correct.
So you just calculate your months and give it a score.
In my
Coming
previous video, I had covered the N number. So if they don't know what that is, then they can just refer to that video. But anyway, it's not there anymore. So that's good news.
the years, yeah. Going to the second point, it remains similar to the previous one. The number of months spent in other specialties than general surgery. This is something, as she had previously mentioned, that it is a very good point, because if you have done some other rotations like urology or plastic surgery, it just not gives you marks in this question, but also subtracts your number of months experience in general surgery and gives you extra point in the first question. So this is something you should try to snatch marks on.
Yeah.
So now I'm coming to the third question. It remains as the previous one, number of appendicectomies. Here, the difference is that previously a very high number of appendicectomies, both laparoscopic and open, were given marks. I believe it was up to 99 or higher number that you could earn a lot of marks. this year, if you see, the cap maximum marks is just on 36 to 45 number of appendectomies. So this is some disadvantage to people who have been experienced. So make sure when you're moving here, you get your logbook updated correctly, get it signed by your Indian consultants, and when you come here, get it signed by a UK consultant as well. But this is something which is just straight away. Okay. Going to the fourth question, this is about the publications. Now, again, this has been a very supportive change this year. This year says that we just have to give two best publications. Previously, people used to submit as many publications as there were. For me, I had calculated at least 3, 4 big publications for me to score enough. But this year, it's just two best publications, which is PubMed Index Journal, but it includes case reports, abstracts, letters to editors as well. Previously, case reports and abstracts were not included in these to submit as a self-assessment score. So this is again a very major change, which gives advantage to most of the residents or people, because it's very difficult at a very young age to have very good first paper author publications. So
Exactly. And
this
I
is,
can see that in this question, previously it was first author publication. Now I don't think first author is a criteria anymore.
yeah, definitely, people can score a lot more by giving first author publication or original research papers. So they would maximize marks. It's not that people who just gave case reports give the maximum marks. They get less marks as compared to people who give original papers, but still they score something.
Something, yeah. Previously they wouldn't score anything then in that section.
So this is again a very positive change. Coming to the fifth question, again, these are the best presentations you have done. As you can see, I've highlighted it is just two best presentations. So you just have to give your two best. Try to do some international presentation in the time you have. It's easy. There are plenty of presentations happening all the time. Just register for one and give it. And please note, it includes poster presentations as well. So
That is
even
also another change, I think, because previously they did not include poster.
exactly. So even video presentation, poster presentations, I'm sure all of us has good opportunities to do these presentations. Previously, it was original paper presentations, but now it includes everything and it's just two best. So you don't have to worry about the volume of presentations you do. You just need to work on just two best of them. So it's again a very positive change. And obviously, in these places, people get more marks if you do an international presentation as compared to a local presentation. If the value, the paper presentation was about a meaningful topic, what was your role, were you presenting, all these things give you more marks. But nevertheless, any kind of evidence you provide will give you at least some marks, so you will not score zero on any of these.
So, Sakina, from the evidence that you provided, did you include the meeting itinerary and the summary of the meeting and your slides as well?
Yeah, so I just had to include two things. One is the certificate which we get provided by the conference anyway. So I presented that certificate and I uploaded a presentation which I had made at the time. So we have to give just two of them: the
Okay.
certificate and the presentation uh, given at the time of conference.
Okay.
Uh, Coming to the audits, as Dhanashri has previously mentioned in a video, these are very, very scoring things, because as compared to publications and presentations, these can be done very quickly in a hospital. And now the best part is it's just 3 audits you need to provide. Two of them if has to be closed loop, which will fetch you marks, and one is just a single cycle audit. Now, we can have a detailed chat later at some point about what is audits and how to carry it out, or I'm sure Dhanashri will be happy to make a video for you guys. But audit is something which can be done very quickly. Obviously, you score marks if your audit was a national level audit, or it was a very impactful audit, or it was a new change introduced into the hospital. All these things fetch you more marks. But any level of audit, mine was all regional audits, any audit which I have done fetched me some marks. So still I was scoring in every aspect, despite the fact that I was very new to the NHS before I could even build my portfolio. So these things are very important, that just an effort just to do a couple of audits and will give you more marks. Better if you can do it very high quality one, but absolutely no pressure there. Just do some audit and you'll still get some marks.
So you did all your audits after coming to the UK then?
I did two of the audit in the UK, but one I already started working on the India, because when I was around waiting here, waiting for my GMC and waiting for moving here, I spoke to some people. I got little orientation about how the training process works, and I did a audit that time in India. It was just a single cycle audit, but still, I was not sure how much it would be rewarding for me. But I just did it. But I was very fortunate that this year, even one cycle audit was included as one of the best audits. So I was very fortunate. So that's a good thing now. So people who are still in India and waiting to move here, you can still start building your portfolio by doing these simple things, because as you can see, things are relaxed now. So it's best to use the advantage we have right now.
Correct.
Coming to the seventh question, which is just since there last year, it is the PG degree or the masters we do. Now if you also trained did MS like me and Dhanashri in India or anywhere else with a thesis, you can see that you'll get a 0.3, the masters with thesis. So make sure you get a thesis completing certificate from your hospital if you don't have one now. And there is UKNARIC, which is a easy site. You just have to go search UKNARIC and just do your validation through of your master's degree through that. So it's something very straightforward, and I'm sure most of us can score well on that. So this summarizes the shortlisting process. Previously, there used to be marks for teaching and leadership as well in shortlisting process, but now these are considered a part of the interview. So shortlisting is small and compact now, and as I can believe, it is very much easy to score as compared to the previous years.
So can I just ask, Sakina, how much did you actually score, if you don't mind sharing that?
So I got 67% out of 120 total marks. I got 80 marks.
80 marks. Okay. And did you find that whatever evidence that you had submitted, because it's very subjective the way they're assessing your scores. So did you think that it was a little, you expected a bit more, but they gave you less marks?
Yeah, I felt so specifically with my audit because I thought I had done a very good audit by improving the BT prophylaxis in the hospital, which I thought is very effective. However, for them, the difference I created was around 70%, but they put a point saying that this is not effective enough. They want higher numbers. And similarly, I did an audit about the Glasgow scoring for pancreatitis, but they said that they thought it has to be more impactful. I challenged it, but obviously there was not any change in that. But yeah, and I must say, because when I spoke to the core trainees who have been here and working here, even they scored somewhere around me or even less, because the rules which were there for even were very strict for even the core trainees. So these obviously get us more advantage if because we are experienced, but overall the stringiness of the shortlisting process was at disadvantage for even the core trainees here.
So
So
yeah.
we all are same, we all have, it's very difficult to do an international level work, it's very difficult to do publications in so much less time, it's very difficult to have like a first paper author publication. So we all are at same, the core trainees here in India, everybody is struggling through the same thing. So we just have to learn what the system is asking us to do and provide that evidence, and we should be all fine.
Exactly. And the best part about UK training is that there is no bias towards their own core surgical candidates. In the UK, whether you're a core trainee or a trust grade, there's no bias. So if you work equally hard, you can get through. So that is the point that we want to come across, that just make sure that all these criteria are fulfilled and work smart and not hard. You don't need 10 publications, you just need two. So if you work hard, then I think they can get through as well.
And I would thank Dhanashri for addressing the elephant in the room. Yes, it's true that we are not from here, we are not native here, but as she said, the NHS is open to everybody who does basic hard work and know their basics. So even the interview process, I was listening to a lot of negative uh, comments all the time, and some negative advices. Oh, really, you are not from the UK, you might not do the same, they would not look at you the same. But
Exactly.
that's nothing. They all are looking basically at someone who knows the basic, who are able to answer in a safe manner. They know that they are going to be a safe doctor, and they know their basics, and they are able to speak something obvious and not be tangential in their approach of answering questions even in the interview. So
Correct.
that's all what is required. So I'm sure people who have experience will definitely do well because they know their surgery, so they just need to speak it loud correctly in front of that. That's all
So
is
coming to
needed.
the interview, Sakina, so there are three stations, correct? Can you just walk us through the stations and how you approached each station?
Sure. So the station basically in an interview is approximately 35 to 40 minutes. The interview per se is 30 minutes. So it comprises clinical station for 10 minutes Viva time, management station 10 minutes Viva time, and portfolio section 10 minutes Viva time. And each station will be preceded by a 5 minutes break. In clinical and management time, the 5 minutes break preceding the interview per se would be about reading the station they are giving you, the clinical scenario or the management scenario they're giving you. So in 5 minutes time, you can read through the question or start organizing yourself and bracing yourself to give a good answer during the interview per se. So to begin with the clinical station, it's a 10 minutes interview time, as I said, and 5 minutes read time. They will give you a clinical station in which somebody is unwell and you need to manage the situation. So usually, typically, we need to use CRISP protocol or ITLS protocol. So way of saying it is, this is a very challenging situation. There are multiple issues. There are clinical issues in which there's some patient day 5 colorectal anastomosis or anterior resection is having abdominal pain, spiking temperature. I'm worried about anastomotic leak, a post-operative collection. Also, I need to rule out other things. So these, in the beginning of the station itself, you organize yourself. You give an opening statement in which you mention what is the situation briefly, and you've given your differentials. So right away, the interviews know that this person understands what are the concerns right way. And
Correct.
then you go to that, I'm going to use a CRISP protocol, or care of critically ill surgical patients protocol, to assess, try to discuss, say something A, B, C, D, E, in which try to say things like resuscitation, sepsis 6 bundle. So when you say these obvious words, the interviewer knows that this person knows their thing. I'm sure we all know how to manage unwell patients, but it's these words that you need to say out loud in a very structured and methodical manner so that the interview is with you in this process and they are giving you marks because they have a chart and they have a tick box. Now they are interviewing up to 288 candidates over a period of three days. So it's a large number of students. For them, they are not try to catch you. They are just trying to listen to these words when you say, so they know that you know your thing and they are able to give you marks right away. So
So
try
you
to
just
pick
need
up.
to give them what they're looking for.
Yeah, and because it's just 10 minutes. So in all the situations, if you think 10 minutes is a long time, it is not. There's a lot to speak. So when you stay structured, when you use these small important words, it's easy for you and it's easy for them. Okay, so in clinical, what they try to score you first is for recognition of the clinical issues. So that's when you start saying that this is the situation, and my concerns is anastomotically post-op collection, uh, pulmonary thromboembolism, heart failure, whatever the situations, things your differential could be.
Correct.
Then prioritization, especially if you have, they can give you situations like you have a patient unwell in A&E, you have a patient unwell in the ward. What will you prioritize? So you prioritize would be depending on the situation. You could say the ward patient is not a safe place. So I would attend to the ward patient, and I would ask my SHO or my F1 to join the A&E doctors to resuscitate a patient in the A&E. So these prioritizations is looking for. And believe me, this is what happens in the NHS. So if you hopefully get to work in NHS before you interview, you would make these questions would make sense. It's just so many things to do at one point of time, and you're just one person. How would you prioritize? And that's where you get your marks. So one is recognition of the issues, second is prioritization, third is planning and use of investigations. Now this is again something we keep on doing when we see an unwell patient. If we use a CT scan, or if we want to do a X-ray, if we want to what set of bloods we want to do. These are all the investigations, and you just need to list them out as required. If the patient is potentially going for a theater, say that you would do a group and save, a clotting, say that you would use objective scoring systems like NELA scores, National Emergency Laparotomy Audit Score, which I'm sure if you start working in the NHS, you would be using it all the time. So using these words will again give you marks. And last is the communication strategy, because they want to see how well you are able to communicate. Basically, escalate to your consultant early on so that you know that you have done your assessment, but now the consultant needs to commit. So call the consultant, call the theater coordinator, tell them that the patient needs theaters, get the anesthetist in early. So that's what you all do all the time. Just saying in a very structured
Yeah.
way would
They just want to
achieve.
know that you're a team player as well, because that is an important part of working in the NHS.
So that's where you can do. And in this scenario, I scored 90% because I was able to tell everything. I just lost some marks because I missed a couple of things, but that's what happens in interviews. In 10 minutes time, it's a lot of happening, a lot of pressure. So just need to say these
So
things.
the only thing you can rely on is your structure, because in
Exactly.
this pressure situation, only your structure is going to come to your head. The rest of the things you're just going to say out of your own experience.
Exactly. And that's when I think Dhanashi has covered it previously many times. Practice, practice, practice.
Yeah.
Find a partner, find a friend, speak to your boyfriend, girlfriend, whoever you have, catch hold of your consultants, just keep practicing. It has to become your second nature, because in this pressure time, what works is the practice you have done, because it's 10 minutes is a lot of pressure time, believe
Yeah.
me.
Yeah. Okay.
Coming to the next station, that is the management station, it pretty much remains the same. In management, what they try to give you is that you have sicknesses in your team and you are the only person managing something, or you were in a clinic with a consultant, but the consultant had to go because they were called into the theaters. So these basic situations, or there are a lot of patients to be waiting, somebody is fighting, somebody is really unwell,
Yeah.
so your F1 is not able to keep up. So these are the management scenarios. And believe me, it happens in the NHS all the time. Less number of people, but a lot of work. So what they're trying to see in your management station is how structured you are, how calmly you can think, delegate work to whatever people you have, reach out to the right people to get you people to help you in that situation, and just prioritization and using the best whatever facilities you have best. Now, this is something I would like to share. I was very new to the NHS before I have my interview. I had like 8 months experience, which is okay, but still it is not enough. Give yourself self time, start practicing these management scenarios with people. There are a lot of question banks. When you start doing, you still expose yourself to all those possibilities, and just practicing from the right away gives you time frame to prepare from all these situations. When you get these questions, they pretty much remain within those question banks. The structure remains pretty much the same. So when you practice from the beginning, you would allow yourself some time to expose to all these possibilities and do much better in a management scenario. But apart from what I lost marks about a breast clinic, I still was able to score okay because my structure remained well, and I was at least able to address the issues. And I lost some marks, but that was all right. I still cleared the interview. So this is about the management. Just to quickly tell you what points they give you, what are the scoring points in management. Just a second. It's again recognition of the issues, prioritization, communication, and team working and solutions. Pretty much what it was for the clinical station. And lastly, there's a portfolio station. Now, as I mentioned to you previously, leadership and teaching are not shortlisting questions anymore. They are interview questions. So be assured in your portfolio, in your 10 minutes, they would ask you to talk about your management or your leadership experience and your teaching experience. Now, this something is I'm sure we all have multiple experiences with leadership and teaching, but try to pick up something which it was very important to you, which give you more maximum development as a doctor or as a leader. For example, because what they're trying to, when you answer these questions, what they're trying to see from you is how you reflected on that activity you did, on that experience of yours, to develop yourself as a better clinician, as a better leader. So the way you give them the answer is what they are looking for. So this is basically you, what would you choose to answer at that point of time. Obviously you need to start practicing it, because you know they are going to ask you something about your teaching and your leadership. So start writing that answers down from beginning and practice it in front of a mirror from the starting, because how confidently you deliver will fetch you marks.
And it's quite a
And
difficult question to answer, right? Because we all have some teaching experience, some leadership experience. But when it comes to actually answering this question, you have to, think about what you want to say. So it's better to practice this beforehand. And as you said, talk about how it helped you to grow as a doctor or as a leader, rather than just how it benefited others.
yeah, definitely. One objective point in this is try to pick up something which what you did nationally or at a regional level, that more than a local level. Those things would definitely fetch you marks. Even I lost mark because I kind of talked about my experience, and I was very happy to discuss with it, and I thought I developed myself a lot, but still I didn't get the full marks because they said they were not sure what was the reach of the effect I created.
Correct.
So try to be very objective when you say your effect, the skill, whatever you did, the experience you had was at a regional level, which involved students of many hospitals, or even in your hospital, but for an entire batch. So try to be very objective
Yeah,
about
and
those
specific.
effects gotten, and it would definitely fetch you marks.
Correct. So, after listening to this, I think if there are three things that you want to tell candidates who are applying this year, what would last things of advice be for them?
Um, there are something which I would try to summarize as first: practice, practice, practice.
Yeah.
It's very difficult to not to know about things till you find practice. Try to find practice groups. I was lucky because I contacted my co-trainee and she introduced me to a group of people who were practicing. So there were 6, 7 people, and there was a consultant who used to supervise us. So I was absolutely lucky in that matter. So try to find such groups and
Yeah.
keep practicing with them. That is the first thing you need to do. Second thing is try to structure your answer, but try to be basic. Stay basic. We all have experience. We have all dealt with these situations. When they give you a question, listen clearly and try to stay basic and think about the situations, similar situations you dealt with, and give them that answer. And third thing is not like the exams we have given in India, in which it's everything you need to do a course and you need to just prepare it, revise it, and give it out. This is more slow process, very demanding process, but just believe in yourself. It pretty much lasts for a year, at least a year or so, this entire application process, because every day you're working on it.
Yeah.
Every trade you think about what would you add on your portfolio. There are courses you have to do. So there are things you need to do. Just take it easy and slow, and believe me, at the end you will find what you're looking for. That's what.
Yeah. Thank
All
you.
the
Thank you, Sakina. and I'm sure you're very excited to start your training soon.
Yeah, I am.
Good.
Dream come true.
Yes, yes. The happiness is shown on your face. So I'm so happy for you. Congratulations again, and thank you for giving us this valuable information. And I'm sure this will really help those from India who want to get into higher surgical training. So thank you so much, Sakina.
Thank you so much, Dhanashri, especially that you need to say that you helped me a lot during this process. It was also guiding me, but also telling me it's possible. Don't
It
give
is,
up.
exactly. I think through my videos, the only thing I want to convey is that it is possible. If you just do the right things, it is possible.
Yes. Thank you very much.
Thank you, Sakina. All right.